So here's the idea. What we want to do is we want to map it out. We want to draw out the different parts. So if you're working with somebody and you want to help them start to name what their different parts are. So you invite them to imagine something just a little bit, a small trigger, nothing super big, a small trigger. There's a small trigger you invite them to think about and notice what parts arise. So there's just a slight trigger. We don't want to go in too deep, but then what parts arise? And then, sometimes, and you might even, if this was kind of consistent with the little fragment kind of diagram, this would be like, okay, maybe there's a lonely part, right? That arises here. And sometimes you can ask, well, how old does that part feel? What feels like maybe 3 years old? And then what does that part think? Well, it has the thought, well, nobody wants me. I'm all alone. And then just giving a little time to that part and noticing it and caring for that. And then inviting if there's any other parts. Well, there's the lonely part that feels like really young and 3 years old. But then there's like maybe an older part that's like really ashamed. There's another kind of ashamed part that starts to think, nobody wants to be around me because I'm dirty and disgusting and bad. I'm really ashamed of who I am. So it might be slightly different. There's a lonely part that turns into an ashamed part that kind of almost becomes makes itself isolate more because it feels like it's not worthwhile. It might feel like around 12 years old. So just noticing that. And then, are there any other parts? Well, maybe there's a depressed part, kind of a part that feels kind of hopeless. It's all my fault. I'm too stupid for anybody to like me. That's another part. How old does that part feel? Maybe 13 years old. And maybe even, a part that feels suicidal. Even, it will kind of really intensely, okay, I don't want to be depressed anymore. It's too painful to feel that. Like, I don't like this and I want to hurt myself. And that might be a certain age space, maybe 17 years old, and just get it over with. You might as well be dead, right? And it might actually even feel angry at the lonely part, like I hate you, like I don't want you, just stop. So it might even re-trigger, right? The 3-year-old part, the young part. So these can interact in negative ways. So how do we move or help the system? And the idea here is, okay, there might be an aspect of self, and in the structural dissociation model, it's called the going on with normal life part. Sometimes they call this the capital S self, right? Or the healthy adult part. There's different languages in different modalities, right? The healthy adult part, which the general idea is that this basically encompasses all parts, sees all parts with heartfulness and love. So this is just like being a loving, kind presence. In the language of what we've learned so far in this curriculum, this would be like the resource. This is like, what is the resource? That there's this other aspect of being, right, that just encompasses, surrounds, and loves, right, all of these other parts, like with protectiveness, care, and nurturance. And then starts to love them and learn, well, what is it that you need? Like each part, okay? Talk to me, that part starts to listen. Oh, well, I need connection. Okay, I need somebody to be with me, right? That's what you need. Okay, well, let's give you that. I can be with you, or you don't have to be lonely. I'm with you, or connects with the ashamed part, right? And say, oh, okay, you need to know that you're not bad. Well, okay, I can see you, and I see that you're not bad, and we can kind of start to develop that and give that each part what it needs. So that's the general idea behind the structural dissociation model.